Good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have had 863,409 cases, 1,239 new cases reported since yesterday, 1,353 people in the hospital, and sadly, 11,288 people who have died. Even as North Carolina battles its way out of this pandemic, we know that people are still sick and sadly still dying from this disease, and our prayers are with them. But I am pleased to report that North Carolina's COVID-19 numbers have declined and remained stable. Last week, we took careful, deliberate action to ease but not lift some of the strict restrictions to move our economy forward while at the same time still protecting public health. And that means we must continue working to keep ourselves and each other safe by wearing a mask and social distancing. These simple measures are still our best tools for slowing the spread of this virus until more people are vaccinated. The State Department of Health and Human Services, our providers, continue to work extremely hard to get people vaccinated in a way that's fast and fair. Our work's getting noticed. Last week, the Kaiser Family Foundation released a report showing North Carolina as the #1 state in the nation for vaccinating people 65 and up. As of today, more than 60% of our seniors have received a vaccine. And there's more good news. The Johnson & Johnson one-shot vaccine is now authorized and will be here this week in North Carolina. It's a real advantage that this is only one shot and more easily stored. And it's been shown to be very effective in preventing hospitalization and death due to COVID-19. We expect to receive 80,000 doses beginning tomorrow. Our constant request for more vaccines has been answered. The federal government is standing up a FEMA-supported vaccination site in Greensboro to open March the 10th. It'll be open 12 hours a day, 7 days a week, and will provide up to 3,000 vaccinations a day for 8 weeks, with additional community sites and mobile vaccination clinics in Guilford and surrounding counties to reach underserved communities. Our state and local emergency management teams are hard at work getting the site ready, and we are working hard with FEMA. That's the kind of partnership we welcome and expect in this fight against the pandemic. Given the current rate of vaccinations and increased supply, many providers say they can move to the next phase of vaccinations. So I'm announcing today that all frontline essential workers in Group 3 will be eligible to receive the vaccine starting tomorrow, March the 3rd. This includes first responders and emergency personnel, such as police, firefighters, rescue workers, people who are working in manufacturing, food and agriculture, grocery stores, government workers, and our clergy, among others. Our essential frontline workers have remained on the job throughout this pandemic, and I'm grateful for their work. We're also announcing that some members of Group 4 will be eligible beginning March 24th. We'll open Group 4 first to people with medical conditions that put them at a higher risk for severe COVID-19 illness. The third vaccine and improving vaccine supply for the 2 we already are getting will help us get more people vaccinated more quickly. But as I've said before, we still don't have enough vaccine. You may have to wait for an appointment, even if today's action means that you're eligible to get vaccinated. People are eager to get vaccinated and still have to wait and plan for when it's time and their turn to get your shot. We've been able to move this quickly because of the great work of the people of North Carolina, the dedication shown by doctors, nurses, pharmacists, and others, including our DHHS staff and local health departments across the state. The patience shown by people eager to get their shot. The trusted voices who are setting good examples and encouraging and helping others. This has come together to make vaccine administration in North Carolina fast and fair. And we're pleased to see all of the educators step forward for vaccines over the past week. It's good to see more school systems getting students back in person into the classroom, as we've urged. School systems that haven't set dates to return are being pushed to get children and educators into the classroom. Learning in person is critically important to students. And I look forward this week to more action to make sure that that happens in a safe way. With declining and stabilizing COVID data, a new vaccine, a new FEMA site in our state, recent increases in total vaccine supply, and the easing of restrictions, there are many reasons to feel hopeful. However, even when we continue to move in the right direction, we know that progress is fragile. New COVID variants are in our state, and vaccines aren't widely available yet. We all must continue to wear our masks and use good judgment. If we recommit to keeping ourselves and each other safe, we can save lives and get to the other side of this pandemic. Also with me today is our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, our Director of Emergency Management, Mike Sprayberry, and Commissioner of Prisons, Todd Ishii. Monica McGee and Lee Williamson are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. I'll now recognize Dr. Cohen for a few remarks. Dr. Cohen.
Well, thank you, Governor. This is a really exciting moment. This weekend, the federal government authorized the Johnson & Johnson one-shot vaccine, and we now have 3 tested, safe, and effective COVID-19 vaccines that are keeping people out of the hospital, keeping them from dying from this virus. A third COVID-19 vaccine means North Carolina can get more people vaccinated sooner and meet our goal to provide equitable access to vaccines in every community across this state. Later this week, as the governor said, we expect to get more than 80,000 doses of Johnson & Johnson vaccine, and we'll be getting 215,000 first doses of the Moderna and the Pfizer vaccines, bringing our state's allocation to almost 300,000 first doses for this week. Additionally, we'll have 160,000 second doses arriving. Busy week. In addition, our state allocation from the federal government is also providing more vaccines through our federal pharmacy program with Walgreens, the FEMA site in Greensboro that the governor discussed, and the federal program with our federally qualified health centers. This is all positive news. While vaccine supplies are still far below what we need to vaccinate everyone, they are improving. Therefore, as the governor noted, all frontline essential workers will be eligible for vaccine starting tomorrow. Our frontline essential workers have been at their jobs throughout this pandemic, making sure we could buy food, keeping us safe, and providing vital services that we all rely upon. Let's take a moment to watch a new PSA featuring these often unsung heroes talking about how and when they plan to get their shot.
Since the start of this pandemic, we responded to nearly 8,000 calls. So that's 8,000 opportunities to contract the virus, and that's also additional 8,000 opportunities to spread the virus.
We have to make sure that our community feels safe, not only by us protecting them, but showing them that we have confidence in the science.
When we talk about us or officers serving and protecting, how better can we show that we're willing to do that than to get a vaccine to ensure the safety of the community we serve.
I decided to take my shot to encourage other people to take theirs. It allows me to be able to go into work and feel like it won't be me next.
We want to make sure that people can get their food, can get their medicine, diapers, milk, all the things that they have to have.
Everybody's got to do their part. If you're not going to get the vaccine, you're just not using your head. And the vaccine is going to save lives.
I lost my dad a week ago from COVID. I don't want anybody else to go through that pain. You're saving not just you, you're saving family members, you're saving other people you don't even know.
We do have a sense of responsibility to the children, to our community, to our families. It's no other way. This is really the only way to push us forward.
You have a spot.
Take your shot.
You have a spot?
Take your shot.
You have a spot.
Take your shot.
You have a spot. Take your shot.
I hope you will share this video along with other resources that you can find at yourspot.yourshot.nc.gov. We need your help in the media in giving North Carolinians accurate information about COVID-19 vaccine. As we look ahead and expect our vaccine supply to continue to improve, we will plan to move to Group 4 on March the 24th. We will begin Group 4 with people who have a medical condition that puts them at higher risk for serious illness, as well as those living in certain congregate settings who have not yet been vaccinated. We've also made some clarification to the groups that I want to go through. First, for Group 1, the definition of long-term care has been updated to include people receiving long-term home care for more than 30 days. This includes home and community-based services for persons with intellectual and developmental disability, private duty nursing, personal care services, home health, and hospice. In addition, for Group 4, we've clarified that higher risk medical conditions include intellectual and developmental disabilities such as Down syndrome and neurologic conditions such as dementia. All of these updates will be on our website, yourspot.yourshot.nc.gov. The top line message is that frontline essential workers are eligible for a vaccine starting tomorrow. All current eligibility groups, healthcare workers, our long-term care staff and residents, and people 65 and older, as well as child care and school staff, will continue to be vaccinated as well. Remember that some vaccines providers may not be ready to open to all frontline essential workers on March 3rd if they're still experiencing high demand for vaccines from those current groups. To slow the spread of COVID-19 and save lives, please continue to practice the 3 Ws, wearing that mask, waiting 6 feet apart, and washing your hands until most people have a spot to take their shot. Thank you, Governor.
Thanks, Dr. Cohen. We continue to appreciate your strong leadership in this area. We'll now take questions from the media. If you could identify yourself and your organization, we'll take the first question.
Our first question is from Ken Lemon with WSOC.
Governor Ken Lemon, WSOC TV. I did want to ask one question in regards to the homeless. And the question is, did we miss an opportunity when we have who are most often transient in a community, have least opportunity to control their own health, and these individuals who are not vaccinated in these areas?
We are deeply concerned about the homeless population, and we are anyway, but when COVID came, we know that people who live in congregate settings have a higher risk of getting and transmitting COVID. We saw that in nursing homes, in prisons, and in the homeless population. I know that our department has worked very hard to provide services for them, to find quarantine support for them. I'll let Dr. Cohen talk a little bit about some of the specific things that are happening out there, but we know that this is a societal issue that we have to tackle together with affordable housing, with mental health services. This is a great time to talk about it, expanding Medicaid to people who are working and aren't making enough money to be able to qualify for federal benefits under the Affordable Care Act. But I'll let Dr. Cohen talk a little bit more about some of the services that our department is providing.
Hi, Ken. Specifically related to those who are homeless in terms of their access to vaccines, there are a number of ways folks may have already gotten vaccinated. Obviously, anyone who is 65 and up who may be homeless is already eligible for a vaccine, as well as those who are the workers who work in our homeless shelters, are frontline essential workers, and as of tomorrow will be eligible for vaccine. And as I mentioned, we're going to be moving to Group 4 on March the 24th. And as I mentioned, we're going to be starting with those who are at higher risk because of their medical conditions, but also in certain congregate settings, and that would include making sure that we're able to get vaccine to our homeless population as well. As the governor mentioned, this has been an area of focus for us throughout this pandemic. As the governor mentioned, whether it was making sure that folks had a place to isolate or quarantine, making sure there was wraparound supports, not just access to testing and a place to isolate, but making sure that they were getting access to the services they need. So has been an important population we've focused on throughout this pandemic. Thank you.
Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. Is the Johnson & Johnson supply going to be a consistent amount week to week? And with the new timeline for those that are eligible for vaccines, is this a goal or a guarantee given the number of people that are in those groups?
So we're going to get 80,000 of the Johnson & Johnson this week, but no, there is no guarantee of a consistent supply. And in fact, we expect a dip in supply of Johnson & Johnson. We were on a call with the White House today. Then that is supposed to ramp back up. But I think, and I'll let Dr. Cohen expound on this, but I do think that because of the Johnson & Johnson, we also got told today that we were going to receive an even greater supply of Pfizer and Moderna. With all of that together, I think the department feels pretty confident that we'll be able to stick to these dates for being able to open even more groups for vaccines. But I'll let Dr. Cohen address that specifically.
Hi, Dawn. So yes, we plan to get about 80,000 doses starting this week. It'll start tomorrow and Thursday. They'll be arriving Wednesday and Thursday of this week. We've already been told that we will receive no additional doses for next week. So we are giving our vaccinating providers a little more time to make sure that they can get those 80,000 doses out over the next week and a half before we will see the next round of Johnson & Johnson come to our state. We do expect over the course of March to see a lower amount of Johnson & Johnson. We know next week will be 0. We think that the week after will be a very low number as well. But as the governor mentioned, we've heard that it is forecasted that by the last week of March, first week of April, that we should be seeing a pickup in the number of Johnson & Johnson vaccines, and they expect to have even more than 80,000 doses per week after that point. So we're appreciative of our vaccine providers that this week we did a special request to them to say who is ready for the 1-dose vaccines. And there were providers all across the state who we're going to be in 33 counties with the Johnson & Johnson vaccine this week at 43 different events. And so it will be widely